In a time where our connections with the people and support systems we usually rely on have been fractured by lockdowns and social distancing, people's faiths have also been impacted. Coronavirus restrictions have forced places of worship to stop or limit services, with many moving to online worship. Weddings and funerals have been affected in various ways. On this video, we will be hearing from different faith and community leaders about their response to the Covid-19 pandemic and some of the challenge they face.
I think there have been three things in particular for me. One was the challenge of simply keeping in touch with as many people as possible in our congregations. In the normal run of things, we would have people gathering together in quite large numbers for services or for meetings, and therefore, we would see most people together, perhaps on a Sunday or at midweek meetings. And of course, during the pandemic, for much of the time, that simply hasn't been possible. We simply haven't seen people in large groups during this time. So it's become even more important then to try to make sure that we've kept in touch really with everybody and to keep those friendships being expressed.
Not having people in your home, we do a terrific amount of entertaining, particularly amongst the student world, who are not anchored to any particular area, so they can be everywhere. And we always have them around on the Friday night or on the Saturday lunch for the Sabbath meals, and the place was empty. We couldn't do anything, and that was very, very difficult.
Well, during the pandemic, I was keeping constant contact with the parents because, like I say, it's not just a game of snooker, it's about making sure that the families are safe and well. So, for instance, I did my weekly calls with parents and carers and looked after children. And I found out that one child didn't have any form of internet use whatsoever. You couldn't get online to our quizzes and our activities during the first lockdown. I found out that it was always just watching the same DVD day in, day out. I found that out by my mother. So we went to work and we put an advert out on social media. Luckily, a company called PlusNet came back and offered the family free internet so they could get connectivity. Other kind people donated games consoles as such, and so he could get online computers with his activity. So we got him connected to the outside world so he could see people and his friends that we missed at snooker. So I think we did really well there, getting that child, back into some kind of normality and speaking to people in that way, really. So I think that was very important, and we also supported a lot of young people who were suffering with mental health problems by just being there over the phone for them to discuss what their worries were.
If the big life-changing events were interrupted by another life-changing thing, a pandemic emergency, and so having support, whether it was because of life change, relationship ending, circumstances changing dramatically, or bereavement, we've had to work extra hard to support people both through one-to-one support and peer-to-peer groups where people could share their experiences and learn. It's been very hard though, because the pandemic emergency is interrupting people's lives and their grieving especially. And so this is a long-term challenge for the future about how we can support people in responding in a holistic way to really difficult times personally for them.
Yeah, during COVID, firstly, we have to follow the government guideline because the government stepped up and they were our mentor into anything that we do. And then the community as well. Many other community leaders like me, we joined forces to try and deliver for our different organizations. Particularly for Sadaka, what we did was to improve on our hygiene and making sure that everybody who comes here follow the guideline, encouraging people to get the vaccination, the 2 COVID jabs, which we did successfully. And also at the daycare center, we asked our elder as well to follow the government guideline. Then following the government guideline has been exactly what we did, nothing else, nothing more.
The pandemic hit, it was action stations, and one of the things we do is we help churches and faith communities in the city connect with the needs of the city, and we immediately pulled together a group of people who were all involved in food banks and food provision across the city, and we started hosting weekly calls, Zoom calls, to just pull everyone together and help them coordinate the supply chain and all of the different things they were doing in terms of their food bank and food provision services.
Well, our organisation was one of the frontline organisations because we were providing food bank facilities. So we had a group of us who used to go out and help people who couldn't come out and get their shopping and stuff. That's what we did.
It was very challenging, taking into consideration many of our worshippers are elderly. Majority of the mosque was closed. It was not possible to open, and many BME has suffered and many has died. And we advise everyone to pray in the house and not to come to the mosque.
During the pandemic, it was a very difficult time, particularly in the beginning of the pandemic. We realised that we couldn't work alone as an organisation and that we need to network with other BAME organisations in Sheffield so we can respond to the needs in our community. Those needs were huge during the pandemic. People, particularly older people, they couldn't go to get their prescriptions, they couldn't go to the supermarket to get their food, and they couldn't basically communicate with each other, which they usually do in cafes or local areas like Bain Greve and Page Hall and Pear Park. So we had to respond to a very difficult situation to help these people come out of that sort of situation where they felt lonely and felt they didn't have the services that they usually have, and try to respond by giving them something that they required, and we did just that.
I just hope that the way and what I've seen, the love, the compassion, how people have pulled together to help each other, regardless of looking at their background, their faith, their age. People have just bonded just to help each other, and especially the most vulnerable in our communities. Nobody looked at, whether it, what benefit am I going to get out of it. And I hope, I know we're not going to come out of the pandemic so soon, but I hope that this love, compassion stays and continues, because I've seen so much humbleness, so much beautiful people. We do have some negativity out there, I'm not going to deny that, but I think the love and compassion of those wonderful people I've seen, I think that outweighs that negativity, and I hope this continues.
Well, we are hoping that this will be controlled soon, and then people will follow according to the rules of the nation, and we think that people learn the lessons out of this pandemic, that we follow the rules and regulations, otherwise it will be tremendous disaster in our life. We were lucky, we monitored our all congregations, and there was only one person who had a COVID. All others were very safe. And this person who had a COVID was working in the hospital atmosphere, and that's why he caught the perhaps COVID.
Well, I think from a personal level, and if I'm thinking specifically about synagogue community, there's been a few people, especially within the community, who've been an extra support to me, because as I'm the main community organiser, it's sometimes been really stressful to make sure that we're doing everything safely, that we're looking after everybody, that we're thinking about all the different elements. And there's been a couple of people, I don't know if I will name names because they might not want that, but just a couple of people who've really just been there if I needed a chat. Listened to me cry sometimes and just given me that extra support that I think I really needed doing this job during this time. Also, of course, I'm going to say like key workers in general have, you know, they've had to do a really, really tough job. I live with a key worker as well. I'm also a youth worker, so technically a key worker in my other job. But yeah, it's been a very tough time to be doing that, and I just really appreciate all the work those people are doing. And you know, whether it's cleaners, people in shops, doctors, nurses, care home staff, like people have really had to make a lot of sacrifices when they've been doing those jobs.
One of the things that we're doing here is we want to sort of do a way of life, like a monastic way of living. So whether our prayer life, eating together, doing the art set up as a sort of a social gathering, faith or no faith, and then outdoor activity. How do we do that? So as we look to the future, one of the things is how do we start gathering people again around food, around conversations, and if it's about wholeness, how do we talk about the spiritual and the physical? How do we create space? There's the Greenland estate behind us. We would love to do some sort of connections on there. Space to just generally listen, and we would love for there to be a deeper sense for the area. I hope for the future of a sense of belonging for the local people, likewise to each other as well as to the area. How do we love Attercliffe and Darnall together with all the diversities and the changes? And that's our hope in what we do.
The people who were working in the NHS, in hospitals, doctors and nurses who were working. I know people who worked, you know, throughout they remained there. They never had break. But you know, having in that terrible summer where it was, you know, breathing was normally very difficult, and some of them were wearing masks for 24 hours, for 12 hours, for 13 hours, for 16 hours, constantly, and such medical masks, you know, that their face were fully covered. And we had a, you know, a tremendous, you know, kind of effect on them psychologically, as well as, you know, losing so many of them.
Rather than an hero, I think it's heroes, the unsung and the unknown people that did the very low-level relational stuff that no one will ever know about. Yes. The people that we've met who watched out for their neighbours and noticed if they'd not walked down the road that day and just checked on them, or kind of just went and got somebody a loaf of bread, but they would never realise the difference that they were making, although they made all the difference for that person on that day. The person who just who kind of did those little things that nobody will ever know about, but you know, kind of the things that you hear about that you just think you made such a difference to one person. But none of us will ever know those stories, other than if we were the person that was affected by it. And yeah, I just think, you know, often we forget that it's the little things that we do that make the big difference.
My daughter-in-law was a frontline worker. She is a respiratory nurse. Normally she's on the district, so she's going around in a car dealing with people who have respiratory problems, illnesses. But of course, during the COVID crisis, she was brought into the Northern General Hospital, and so she, you know, for me, is one of the people that I'm very proud of, and want to sort of affirm. But also, of course, she represents for me all those myriads of other people in the National Health Service and in the caring services who supported and helped us in these very, very, very challenging and difficult times. So they're my heroes, the quiet people, not the people who, you know, were at the front sort of, you know, leading, but those quiet people who just got on and cared for people and